and is lagging behind in progress toward MDG targets, with only 60% of the population using improved sources of drinking water. For families without drinking water sources, it is usually women who go to the source to collect drinking water. Current data show that more than a quarter of the population in several sub-Saharan countries take longer than 30 minutes to make one water collection round trip. Ladies and gentlemen, water-related diseases are the most common causes of illness and death among the poor. Half of the people in the developing world suffer from one or more of the main diseases associated with inadequate provision of water supply and sanitation services. Every 20 seconds, a child dies from a water-related disease. 1.8 million children younger than 5 years each year. This alarming figure is from a new report of the United Nations Environmental Programme, which says millions of tons of solid waste are being flushed into water systems every day, spreading diseases. I firmly believe that the importance of safe drinking water and basic sanitation to the preservation of human health, particularly among children, cannot be overstated. Indeed, this is a silent humanitarian crisis that each day takes thousands of lives, robs the poorest of their health, thwarts progress towards gender equality, and hamstrings economic development. Ladies and gentlemen, realizing the health-related MDGs, particularly those targeting child mortality and major diseases, will require a dramatic increase in access to safe drinking water and basic sanitation services for poor women, men, and children in developing countries. It will also require changes in behavior and attitude, particularly with regard to hygiene, a critical but often overlooked element in discussions, usually dominated by questions of access and service provision. Almost 1/10 of the global disease burden could be prevented by improving water supply, sanitation, hygiene, and management of water resources. Cost-effective, resilient, and sustainable solutions have proven to alleviate the disease burden. Action is required to ensure these are implemented and sustained worldwide, and especially to the benefit of the most affected populations, children in developing countries. Undoubtedly, ensuring poor people's access to safe drinking water and adequate sanitation, and encouraging personal, domestic, and community hygiene will improve the quality of life of millions of individuals. Better managing water resources to reduce the transmission of vector-borne disease, such as viral diseases carried by mosquitoes, and to make water bodies safe for recreational and other users can save many lives and has an extensive direct and indirect economic benefit from the micro level of households to the macro perspective of national economies. Water challenges will increase significantly in the coming years. Continuing population growth and raising income will lead to greater water consumption as well as more waste. These challenges are compounded by the effects of climate change in the poorest countries, especially the least developed countries and the small island developing state. The urban population in developing countries will grow dramatically, generating demand well beyond the capacity of already inadequate water supply and sanitation infrastructure and services. By 2050, at least 1 in 4 people are likely to live in a country affected by chronic or recurring shortage of fresh water. This might seriously constrain the availability of water for all purposes, particularly for agriculture, which currently account for 70% of all water consumed. One of the main questions I believe we should be asking is how can we best articulate the political significance of water and sanitation? Decision-making in environment and health in general, and in water, sanitation, and hygiene in particular, involve the participation of many actors and different sectors. In particular, government and other stakeholders must move the sanitation crisis on the top of the agenda. An important outcome of the first World Water Forum held in Marrakesh, Morocco, in 1997 was the Africa Water Vision for 2025. The vision is designed to avoid disastrous consequences of these threats and lead to a future where the full potential of Africa's water resources can be readily unleashed to stimulate and sustain growth in the region's economic development and social well-being. The framework sets the targets to reduce by 75% the proportion of people without access to safe and adequate water supply by 2015, and by 2025, it should be reduced by 95%. And by 2015, the proportion of people without access to safe and adequate sanitation should be reduced by 70%, and by 2025, this should be reduced by 95% again. Under the African Water Vision 2025, African countries agreed to aim to implement measures in all countries to ensure the allocation of sufficient water for environmental sustainability, as well as measures to conserve, restore watershed ecosystem by 2015, and by 2025, it should be extended to all river basins. Ladies and gentlemen, there is a strong need that within the context of national poverty reduction strategies based on MDGs, countries will elaborate coherent water resource development and management plans that will support the achievement of the goals. Furthermore, dramatically expanding coverage of water supply and sanitation services deserves the vigorous response of national government and international community. Improving basic services for the world's poor is also an imperative for the global community committed to principles of equity, fairness, and social responsibility. Without greater attention to the sound management and development of water resources, it will be difficult to meet the MDGs and sustain the gains already made against poverty, hunger, and environmental degradation. It is also important to recall that the mobilization of the global public opinion can lead to action at national and international levels. On a local level and within the community, incentives can be created for private actions and behaviors at household level that lead to a public good in terms of sanitation and hygiene. Finally, targets need to be translated into realistic, operational, politically acceptable targets at the national and subnational levels. These specific targets can be used to empower and involve society at the lowest appropriate level. Attention has to be focused on countries, populations, and groups within society that are most vulnerable and where the problems are the worst, which are often those in remote, rural, and peri-urban areas. I'm strongly convinced that long-term decision-making in water by all actors and at the very level, every level should lead to sustainable use of the world's water resources, sustainable development of society, and improve dignified livelihood of individuals. Thank you very much for your kind attention. Thank you.